There's nothing quite like the peaceful calm of a sleeping infant, but if you're not putting your baby to sleep properly, you could be putting them in danger. Joining me now with Safe Sleeping Tips is Janna Warren from Franklin County Children's Services, along with Dr. Mysheika Roberts, the Assistant Health Commissioner for Columbus Public Health, and welcome to both of you.
Thank you. Thanks for having us.
Such an important topic, and Dr. Roberts, I know that our statistics in Columbus aren't really something we are proud of, and the number of infant deaths has gone up, and do we know why?
No, we don't know why. It is concerning to us, and it's something we've been working on. We know right here in Franklin County, we have about 3 babies that die every week for a variety of different reasons, and we're working hard with the Greater Columbus Infant Mortality Task Force to try to tackle that and solve that as a community.
So that's why this task force was calmed, and I mean, you put it together with all different kinds of organizations and folks to try to find out the why.
Yeah, that's exactly right. President Andy Ginther put the task force together from a variety of different sectors in our community, from housing to health. All the hospitals participated. Franklin County Jobs and Family Services participated. It was a great collaboration, but we have a lot of work to do in this community. Our goal is to reduce our infant mortality rates by 40%. And so we've got a lot of work to do.
So part of that is sharing with folks like Janna at Franklin County Children's Services, where they meet with a lot of families to get that message out there. And Janna, I know there is a message, and what are you trying to explain to some of these families as to what they call safe sleep practices?
We have the very simple ABCs of safe sleep: alone for A, back for B, and C for crib. So we encourage families and caretakers to have their baby alone when they sleep. In the room is good, close to a parent so they can reach out if they need to, but they don't want to have it in the same bed as a parent. That's a very big, a big caution that we urge people not to co-sleep, as we call it. On their back, we want babies to be able to naturally sleep on their back and in a crib. In the picture that you showed there, the crib needs to be empty. A fitted sheet, a nice firm mattress, but safely alone in the crib.
And you find that there are a lot of families that don't do this. They have, as you say, they sleep with the baby, which they can roll over and harm the baby, or other ways that they put a baby in it where it's not a safe situation.
That's correct. Unfortunately, we do see that a lot. People don't realize that what they're doing is putting their babies at risk.
Right, they don't know. And that's part of the education too, isn't it, Dr. Roberts?
Yeah, it is. We really want to encourage babies should have their own special place to sleep. They shouldn't be sleeping on an adult bed. They shouldn't be sleeping on a couch. They really should be sleeping on a crib or a pack and play. And like Janna said, it needs to be free of all toys, pillows, blankets, just like the picture showed.
This goes, though, in the opposite thought process of what I did with my children, which was put them on their stomach, because if you put them on their back, supposedly they would possibly asphyxiate, choke themselves. Why the change?
Well, you know, we've changed because of data and research, but this recommendation has actually been in effect since 1992, that babies should be sleeping alone on their back and in a crib. And we're slowly getting that message out to families, because we've seen so many babies in our community who have died in circumstances where they weren't alone, they weren't on their back, or they weren't in a crib. So we're really working hard in this community with partners like Franklin County Children's Services to get this message out.
And it really does take this partnership. And Janna, are the families or the parents that you talk to, are they open to this?
Yes, they're very open, and unfortunately they just don't know. So when we go out, our workers actually go into the home, ask to view where the baby is sleeping, and physically go through with the family what they can do to make it safer for their baby. And they're very open and receptive to our help.
And what other organizations then, Doctor, are you working with to try to get this word out to people?
Well, obviously we're working with all of our hospitals where babies are delivered, and the hospitals are modeling that practice in the hospital, because that's important. Parents see that. But we also want to make sure that parents understand it shouldn't just stop with them. It should also be their caregivers. So the grandmothers, the aunts, the babysitters,
correct,
whoever's caring for the baby should understand the ABCs, and also understand things like the baby shouldn't be in a smoking environment. The baby's crib and where the baby rests should be in a smoke-free environment as much as possible. So there are a lot of different factors that go into this, and we're reaching out. We have some spots that we're working with the Ohio Department of Health as well as a partner for this campaign.
And what about these onesies?
You can see on the baby we have a very cute onesie. These were a part of the collaboration to encourage people and remind people that the babies need to be on their back. And on the back side,
it says, turn me over. If you happen to put that baby on his stomach, that's a reminder to mom and dad or whoever to turn that baby the other direction. That's a great reminder and good stuff. Well, thank you both for being here. And I don't think we can talk about it enough, can we, Dr.
No,
We just
can't.
need to keep spreading that important message.
We do.
Thank you.
Thanks for having us.